So I graduated from nursing school at Boston College, and after nursing school I actually came back home to Rhode Island, and I worked at Rhode Island Hospital for a year on a burn and trauma unit. And then I really wanted to get into cardiac care, so I went back up to Boston and worked at Mass General for a number of years in cardiac surgery, cardiac medicine, and cardiac rehab. And then I had a family and went into community health nursing in the area and went back to school and got my master's. And then when my youngest went to kindergarten, I decided I wanted to teach, and that's really where I found my passion in nursing. Stayed in nursing education, for the past 20 plus years, and went from assistant professor to full professor. Got my doctorate as well in those years, and then the last 5 years I was dean of a nursing program. I think the biggest attraction was really the reputation of Providence College as just a very highly esteemed institution of higher education. The liberal arts core that you have here at Providence College really is, is just something that spoke to me as far as basing a nursing program in a school that had such a strong liberal arts core, really, and also the mission and the ministry of the Catholic Dominican tradition. It just seemed to me that this energy of a nursing program here would be just a beautiful fit, and that it would be something that I would love to build. So the nursing courses that we'll have here at Providence College are the traditional nursing courses. We have an introduction to professional nursing course in the freshman year, which I think will be wonderful for students to be engaged in nursing early on. We also finish that off with a transition to professional nursing course in the senior year. We also have 7 clinical courses, which our students will be out in all the healthcare facilities in Rhode Island and regionally in Boston, doing over 700 hours of clinical work before they graduate. We also have a one-on-one clinical internship course where, after the students have done the specialties of psychiatric nursing, PD, med-surg, OB, community, they can choose an area that they're really passionate about and do a one-on-one internship in that area. And that's led to great jobs, opportunities for a lot of our students. They'll also be taking courses in health equity and a course in bioethics taught by our liberal arts, our outstanding humanities faculty here. And we'll have elective courses in the health policy management program, which is another outstanding long program here at Providence College with a great reputation. And I think those elective courses will greatly benefit our nursing students. So our students will also be taking courses in research methods and doing a capstone project, and this will position them very nicely for graduate work. And we anticipate many of our graduates will go on to graduate work in nursing. So I think there'll be quite a few distinguishing components of the Providence College nursing program. One of the biggest changes we've seen in nursing education in the past 30 years are new accreditation guidelines for nursing, and the ability to have a program. I think it'll give us a huge advantage that our program will be built on these new guidelines. So these guidelines were based on research that was done to find the gaps in nursing education and really what are the skills and knowledge skills that our nurses need in today's healthcare environment. And so our program will be based and built on what those skills and knowledge areas are. So I think that's a huge advantage to the PC nursing program. I think also our focus on community and public health and really exposing our students to ways that they can impact the social determinants of health will be a large component and an advantage of our program. In order to do that, we'll expose our students to experiential learning and volunteer opportunities both in Providence, regionally, and internationally. We hope to have some trips to resource-poor settings, immersion trips for our students. We're building our nursing program we're building the curriculum with organizing themes around holistic growth, and moral formation of our nursing students so they can go out and practice both the art and science of nursing. We're also building a world-class nursing building here on the PC campus, which will just engage our students in realistic simulations and classroom experiences. All our learning will be active learning in the classroom. We have set up our classrooms to also be labs, so they're learning theory and practice and skills at the same time, which is more engaging to this generation of learners. So we think that really overall our curriculum here at PC is going to be something that's really going to prepare the nurse of the future. So our overall vision for the PC nursing program is that we will produce healers, not necessarily technicians. Again, our curriculum will be based on that formation of our students. We also hope for this program to be a premier nursing program, both regionally and nationally, and that it will produce nurses who are healers and who are ready to tackle the very challenging things we're seeing in healthcare today, with both not only the competency but the confidence to be a nurse today, and that they have all those skills to be successful. We anticipate 100% pass rates on our national licensure examination. We also envision graduate programs here at Providence College, so we'll be building some nurse practitioner programs and other graduate programs, and we anticipate that our graduates will be sought after in nursing positions, and that they will be the next leaders in healthcare, that they will be career ready to go right into leadership roles.